please write it down and provide it to our staff. Our next speaker is Dr. Jagjit Kaur Padda. She is endocrinologist, means hormone doctor. So what changes in your body come, how they are related, these changes, how these changes are related to the diabetes. So Dr. Padda was born in Victoria, and she completed her training in USA. She is a doctor of hormones and metabolism. You already heard her many times on the radio and television. She is just like Dr. Chima, providing information on the media. So to our community, she is educating our community as much as she can. She is now working in Abbotsford and Surrey. So she will share some information with you how diabetes how diabetes is linked to heart and kidney disease. Dr. Padda, please. Thank you, Prabjot. Hello, everyone. Welcome. Today, as Prabjot told, we will talk about diabetes, the link between diabetes, heart disease, and kidneys. Today's topics are heart disease and stroke and heart attack and how they are linked to diabetes, and as well we will talk about what can you do so that the risk factors are reduced. So first we will talk about diabetes and heart disease. Diabetes, how is linked diabetes and heart disease. Heart disease is the biggest cause of death amongst patients with diabetes. Diabetes and heart disease they are equally bad. People who have diabetes, type 2 diabetes, patient with type 2 diabetes without prior heart attack found to be at the same risk for heart attack as patients without diabetes who had a prior heart attack. So there is a famous study that's very much important. Birmingham Heart Study found that the presence of diabetes increased risk for cardiovascular disease by 2 times in men and by 3 times in women as compared to the general public. Compared to non-diabetics, diabetics have higher incidence of multi-vessel disease. So that's why we have to control our blood glucose, so to prevent the complications of diabetes, as Dr. Chima also talked about that. So it's very important to control your blood glucose levels. If your blood sugar is up, then there will be more blood vessels that will be affected. So the diabetes could cause heart failure because the blood cannot flow properly. So from the heart it cannot flow properly. It's called congested heart failure. So the blood vessels, the walls of blood vessels, there are walls to the blood vessels. So the platelet activation leads to platelet aggression is present in your blood, and they all collect where the wound is, and that way they can plug the arteries, and that way the blood is not going to reach properly, adequately to your heart. So we also know that if your sugar is up and it's always up, then there will be more wounds on the walls of the blood vessels. Then you can see this in the photo on your left, how the cholesterol plaque is deposited in your blood vessels. That's how they get plugged, because there is a plaque. cholesterol plaque, and then the blood cannot flow adequately to different organs of your body. So in the next photo you can see how these are the things that can affect your heart: high cholesterol, high blood sugar. All these things affect your blood of your heart. Then we will talk about diabetes, stroke, and heart disease. So how they are linked all together.
So, diabetes, stroke, and heart disease can increase the risk, and so some diabetes there causes other problems as well, and they can cause these problems. And with those risk factors, it can close or plug your arteries, and your blood is not flowing well. And then we talk about diabetes and kidney disease, and how does diabetes affect your kidneys. And first of all, when you have the kidney disease and diabetes, there are no symptoms early on. And I see many patients, when I tell them, there's a symptoms of kidney problems, that tells me, diabetes is affecting your kidney. And then they say, oh, I'm not feeling anything, I'm fine. But first of all, you don't realize it. But after a while, when the problem gets worse, then you get the symptoms. It's very important to diagnose it earlier and control the diabetes so it does not affect your kidneys. A kidney has some functions. What does it do? Kidney filter blood, remove waste and products along with water. Uh, so, it, so it's very important. It's removing the waste products out of your body. So it's very important to protect your kidneys from the effects of diabetes. And other speakers have also talked about this. Diabetic kidney disease can affect you so much that you might have to get the kidney transplant done, and they have to do the surgery, and or they have to send you to dialysis. And if your kidneys are diseased, it can increase risk of heart attack and heart failure. And high glucose levels in the blood can, as I said earlier, can cause blood vessels to become clogged and narrow, resulting in lack of blood flow, which leads to kidney damage. Because blood is not flowing to kidneys well. And nerve damage can lead to miscommunication between the brain and the bladder, leading to the brain's inability to differentiate between an empty and full bladder, and it cannot tell that it's empty or full. The pressure from a full bladder causes kidney damage and can cause a lot of damage to the kidneys. So it's very important to control sugar and blood. It's also important to control blood pressure as well. You can prevent diabetes to affect your kidney. High blood sugar and high blood pressure both damage blood vessels and organs as well. Talk to your doctor about diabetes medication that can work to prevent complications in conjunction with good glycemia control. And it also can help you get your body better. And how is diabetes linked to progression of kidney disease? Physicians will order protein levels, known as albumin, in the urine along with blood tests to evaluate the level of kidney function. So it's recommended to have urine tests done annually. And they also do the blood test too. And it should be done based on your kidney functions at least once a year, maybe more. but you need to talk to your doctor what's right for you. And you can see in this photo, and on the left you can see they are healthy kidneys and the urine is passing fine. And on the right you see how diabetic kidney affects your protein leaking into your urine. Protein is important to retain in your body, but if the protein is leaking in your urine, it's a bad sign. And a lot of speakers will cover this thing today. As we said earlier, exercise, it's very important. And along with exercises, yoga or any meditation, or to control your stress levels as well, because stress can also increase your blood sugar levels. And also monitor your blood glucose levels, and your doctor can diagnose which medication is better for you. If your sugar levels are going up before meals, after meals, and then they can adjust your medication based on that. And as we talked about it today, and we will talk about this more, it's very important to have a balanced diet, and especially carbohydrates. And it's very important to count those and how many carbohydrates you're going to take in your body during the meals, and how
the doctor that who prescribed you this medication is very important. It's very important to take that medication. After 3 months, you should go get your medication again reviewed, so they can give you more ideas. If it's expensive, they can give you an alternative medication, or they can give you good advice. Don't stop taking medications or adjusting your medication. Talk to your doctor. They can give you another medication, or maybe with less side effects, or maybe less expensive, so they can always prescribe you an alternative. What we can do so that we can control our diabetes. So tips for the home management and prevention. So high blood pressure, it's very important to control that, especially the diabetic patient. So we want their blood pressure, the upper blood pressure should be less than 130, and the lower one less than 80. So you can also talk to your doctor. If there are other illnesses, you can adjust accordingly. But diabetic patient, it should be less than 130 and less than 80, and the blood sugar level. If your doctor is testing, there are 4 kind of cholesterol results. We focus on LDL cholesterol, that's the bad cholesterol, like bad cholesterol. So we want it a less than number 2. So if you already have heart attack, if you have heart disease, then we want it less than 1.8. And if you have any questions, you can always talk to your doctor which number is good for you. Generally, if you have any heart problem, it should be less than 2. So it should be checked once at least in a year with fasting. And another, control your weight. So it's very important to control your weight. There is a measure, we call it body mass index. So your body mass index is according your body and height. They can calculate it and they can tell you what it is for you. It should be between 18.5 to 24.9. As we talked earlier, Dr. Chima, A1C, this is the average for 3 months. So it's very important to know how much is your A1C, how are your results, because these are the results of your 3-month blood sugar level. It may be, if you are elderly, then if you are above 80-year-old, there could be little bit adjustment made. You can talk to that about you can talk to your doctor about that. If you are under 60, it's very important how we can keep it when you check your sugar during fasting, it should be 4 to 7. After 2 hours having your meal, it should be between 8 to 10. As Harvinder told you earlier, before, you should, it's very important to keep your foot examined. As we talked earlier, taking medications, whatever medications are prescribed for you, you should be taking them. You can talk to your pharmacist. There are so many medications, how they can prepare a blister pack. With the blister pack, it's easy to take your medications, what time, what day, it's all arranged on your blister packs. So it is very easier to take your medications when you have a blister pack. So you can put it in your phone, you can set alarm on your phone. If you it will be easy to remember what time you are supposed to take your medication. So you can keep some medication in your purse, you can keep some at home, you can keep it along with you when you are going out. So change your diet, it's very important. And also exercising actively, going to the gym. The recommendations generally are that you do 150 minutes to 200 minutes to dedicate to exercise for 5 days. You should set that level. So 15 minutes in the morning, 15 minutes in the evening. Walking is a very good exercise. If somebody is smoking, so please quit smoking, it's very important. And sodium, so reduce sodium intake for blood pressure. You can talk to your doctor about that. Sometimes people have less sodium in their body, so it's not, so if you reduce sodium, it will be helpful to lower your blood pressure. So please check with your doctor and do your blood testing every 3 to 6 months. It's very important, whatever direction your doctor gave to you. So today you can see we have speakers today. Some patients say that I don't want to see my doctor, I don't want to see the nurse, I don't want to see the dietitian, I don't want to see the eye doctor. But you see today how important components, how important this team is, how they can manage your diabetes in a very good way. So there are some medications that those are initially that are used to control the blood pressure, but the research has shown that that also protects the kidney, and they can protect kidneys from diabetes. We also got to know that people who have normal blood pressure, if these medications are given to those patients, they have the benefit to their kidneys. You can talk to this about your doctor. Even cholesterol medication also helps to those medications whose cholesterol is really good. They protected the risk, they lowered the risk, those medications, even to those patients who doesn't have cholesterol. So you can also talk to your family doctor. If you are above 40 years of age, you can take cholesterol medication. It reduces the risk of heart attack. So
ਨਾਲ ਸਭ ਤੋਂ ਵਧੀਆ ਹੁੰਦੀ ਹੈਗੀ ਆ। ਬਾਕੀ ਤੁਸੀਂ ਦੇਖ ਸਕਦੇ ਹੈਗੇ ਆ ਰਿਸੋਰਸਿਸ ਹੈਗੇ ਆ। ਤੁਸੀਂ 811 ਨੂੰ ਫੋਨ ਕਰਕੇ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ 24 ਘੰਟੇ 7 ਦਿਨ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈ ਸਕਦੇ ਹੈਗੇ ਆ। ਤਾਂ ਹੋਰ ਵੀ ਰਿਸੋਰਸਿਸ ਹੈਗੇ ਆ ਜਿਹਦੇ ਬਾਰੇ ਆਪਾਂ
and we'll talk about those. And there are so many references that I'll provide to you. And thank you very much.